So my name is Jennifer. I'm going to be your nurse for today, and I'm going to do the head to toe assessment. And before I do so, I'm going to wash my hands and provide you with privacy. Okay. And could you please tell me your name and your date of birth?
Sheila Arenas since 08/11/95.
Okay. Let me check your arm then. Okay. And do you know what city we are in?
Ocala,
Okay. And do you know what date it is?
January 21st, 2016.
Yes, perfect. And what I'm gonna do is I'm gonna test a sensation in your face. And close your eyes, please. Tell me where I touch.
Forehead, cheek, chin, nose.
And facial sensations are intact. And your posture is upright, and spine is straight, and hygiene is good. And what I'm gonna do now is I'm gonna ask you to squint your face and puff your cheeks. Okay, good. And facial movements are intact, and face is symmetrical. And I'm gonna assess your eyes now. If you can look please straight forward. Okay. I'm gonna shine some light on your eyes. And pupils react to light. And I see no excess discharge or redness in your eyes, and pupils are round and equal. And what I'm gonna do now is I'm gonna have to look straight forward again and look at accommodate to my finger. Perfect. And pupils accommodate to my finger. I'm gonna check your ears now. And I see no excess discharge or serum. No excess discharge or serum. And I'm gonna whisper something in your ear. You're gonna tell me if what you hear, okay?
Sandwich. Bologna.
Good. And I'm gonna inspect your mouth now. Please open up and lift up your tongue. Great. And teeth and tongue are in good condition. Your tongue, your gums are moist and pink. And I'm gonna assess your nose now. And if you could tip your head up a little bit, please. Okay, I see no excess discharge or lesions. And could you cover up one side of your nose and blow out? And same for the other side. And nasal patency is intact. And what I'm going to do now is I'm going to osculate your lungs. If you can please go this way. And you're going to take deep breaths for me, please. Okay? And deep breath. And deep breath. I'm sorry. And deep breath. And deep breath. And I'm going to go under your shirt over here, okay? And deep breath. And deep breath. Okay. I'm going to go on the sides. Sorry. And deep breath. And deep breath. And over here, I'm going to go on the side. Deep breath. Deep breath. Perfect. And you can come back around over here. Lungs are clear to osculation. And your thorax is symmetrical, and AP to lateral is 1 to 2. And your respirations and depth are normal, and I see no accessory muscles being used. And now I'm going to assess your pulses. Okay, you can flip your hand. Perfect. me see your arms, please. And could I ask you to please take off your socks? Okay, and that's pulses are +2 bilaterally equal. And I'm gonna assess your capillary refill. Okay, and it is intact and in range. And let me check here. I see no edema, no tenderness, or no lesions. And I'm going to assess your range of motion now. If you could please put your arms to the side, like that, and push up and down, and put your arms back, and put them forward. And I'm going to have you put your arms like this, and pull, and push. Good. And I'm going to ask you now to move your neck up and down, side to side, and ear to shoulder. Okay. And when you do this too, I need to assess the sides. So push outward and inward. Okay. You can squeeze my finger. Good. And what I'm going to do now is I'm going to oscillate for your sounds, your heart sounds. Okay. If you can move this way, please. And I'm starting off at the aortic. And pulmonary. And the herb spline. And and mitral. I'm gonna go under real quick. Oh, this is the mitral. Okay, and if you could please stand up, I'm gonna finish doing the range of motion. Okay, if you could put your leg forward, back, and side, side. Again, with the other one. Good. And I'm gonna ask you to walk over here and walk back. Okay. And gait is steady. And I'm gonna ask you to put your feet together and put your arms to the side and close your eyes. And balance is intact. And strength is 5 out of 5 too. And range of motion is intact. And if you could please sit back down. Okay. And I'm gonna ask you to push your feet forward and back. Good. Strength is equal and 5 out of 5. And what I'm going to do now is I'm going to ask you to lay down, and I'm going to oscillate for GI sounds. Abdomen is flat, and I'm going to oscillate for sounds now. Lift up your shirt a little bit. Thank you. Let's start here. Okay, and I hear active GI sounds times 4. And I'm gonna palpitate each quadrant, and you're gonna tell me if you feel any pain. No? Mm-mm. No? No? Okay. You can put your shirt back down. And when was your last bowel movement?
Yesterday?
And was there any pain or problems?
No.
And when was the last time you voided?
About 30 minutes ago.
Okay. And was there any problems?
Mm-mm.
And I'm gonna assess your feet strength. If you can push up and push down. Okay, good. And you can sit up now if you would like. And are you comfortable?
Yes, I think so.
Okay. And here's the call bell. If you need me, you can hit the call bell. I'm gonna go wash my hands and document my findings. So if you need me, just hit the call bell. Thank